thank you very much, and it's great to see lots of you here. And if I look a bit bleary-eyed, that's because I have a 7-week-old baby. And yes, I look after adults, and I'm probably what you're all worried about, your children coming to see me eventually, and what will happen. And is it going to be a disaster when they come and see the adult doctors? Because I think there is a lot of concern about what happens when children who've been diagnosed with liver disease or who've had a liver transplant change services. You've had so much faith in your paediatric teams. They've looked after your child, often made them better, and it's a real wrench to move and causes a lot of concern. And I'm just going to really talk about it. And it is a challenging time, and it's challenging for all aspects of those people involved. It's challenging for the young adult going through the transition, but I would actually say that often they're the least challenged by the process of all. It's challenging from the parents. It can be challenging for the paediatrician, for myself, and for the transition team that work with us. And I'm just going to go through all those different groups and why it can be difficult. But prior to saying that, it isn't all bad, actually. Lots of young adults who go through this actually enjoy moving to a service where they perhaps attend appointments more by themselves, they have more time to talk, they feel more of an adult, they're sitting in the waiting room, not with lots of kids, but with adults. So actually it can be a very positive experience and part of them growing up. And I think if we always make out that the transition is a bad thing, then it will be. And so I think being positive about it, because it can often be a very positive process, is important. So if I think about the challenges for the parents, well, the challenges of being a parent, as I say, I've only just become a parent, but it's amazing how that changes your outlook very quickly. And I can't imagine having a sick child and what you guys have been through. I think that must be incredibly hard. But just having someone being a teenager and growing up means losing control. But of course, if they've been unwell and you've looked after them, there's a huge amount of loss of control there, so that can be hard. You're losing, potentially, your previous healthcare provider who you've had so much faith in, and you're thinking, gosh, what's going to happen now? And your young adult is moving on. They may be going off to university, they may be embarking on relationships with other people, they're spending less time with you, they're working, they might actually live in a different part of the country. We see lots of people in our service, for example, from King's College London, who've moved to Birmingham to go to university. So there are lots and lots of challenges for the parent at that time, not just related to the fact that their child has had a liver condition. What about the challenges for the actual paediatric team? Well, they've been used to looking after this young person for often 16, 17 years, and so there's a loss of control there. We, as adult services, it's important that the paediatric team that we work with trusts us. And it's important that they're positive about the change, because if you're sensing off them that this is going to be a bad thing, then you're going to think that this is going to be a bad thing when you move. It's crucial that young adult is prepared for that transition, and there's certain practicalities and certain self-management things that I'll talk about when I move on to what's important for the young person. But for me, what's challenging for me? Well, I've been a consultant for 5 years and started working a transition service, and there are lots of conditions that I hadn't seen before, and I've learnt about over the past year. They're very different to what we deal in adult medicine, and so there's been a challenge for learning about these conditions and how to manage them. There are differing practices. So paediatrics has a different evidence base to adult medicine. So there may be things that are evidence based when you're very little, but when you're an adult, actually it means that you have different treatments. It's important about developing trust. You have to trust the adult service. I have to make sure the paediatric team trust me, and most importantly of all, the patient I'm looking after trusts me. And of course, there's the challenge of working with young adults. I have to say the majority, 95%, are no bother and an absolute delight. But that 5% that difficult can be very, very difficult and very challenging and use up a huge amount of the transition team's time. And I guess that lastly is moving on to the actual patient. What's difficult for them? Well, they're going through adolescence, so it's a hard time anyway. I don't know if you can all remember going through adolescence, but it is a difficult time. There are all sorts of changes, all sorts of things happening, and you want to be in charge, but perhaps you're not so good about thinking about what the implications of your decisions are in the future, so that can be a hard time. You're keen to take on the management of your medicines, but perhaps your parents aren't so keen you do that, and they might not trust that you take it, for example, every day. There's the change in provider, so you're used to one system and then suddenly everything changes. And I said I was going to talk about the practicalities, but there are certain things like prescriptions. Often paediatric services will send out prescriptions in the post. And once you get to the adult world, things change. For example, if you're not in long-term education, you have a job. I don't agree with this, but you have to start paying for prescriptions. Blood tests, again, the way you get your blood test change. And geography, you may have moved somewhere else, and therefore your healthcare providers start to become a bit more disparate. And certainly adult services are very different. What about the impact of transition? Does it make a difference on what happens to the patient? And collaboratively, Professor Kelly and I have performed a study where we looked back at lots of patients who had undergone a liver transplant at the Children's Hospital and then transitioned across. And we looked at how they did. And I think also important that we looked at another cohort. These were young people between 20 and 30 who also developed liver disease and needed liver transplants. So they hadn't gone through the transition process, but they were young when they had their liver transplant. And this study is about to be published. And really there were some important messages. Actually outcomes were pretty good. Not as good as we want them to obviously be perfect, but actually they were pretty good. But interesting that they were best for people who had undergone a transplant when they were very, very young. So, and in fact, people who had undergone a transplant when they were teenagers seemed to struggle more. And in fact, the group that did worst were not those who went through the transition process, but they were young adults who were transplanted in their 20s. And I think that's quite interesting. And importantly, our service is not just a transition service at the Queen Elizabeth, it also looks after young people because they are very, very vulnerable, and it's a hard time to deal with illness and transplantation. What did we find were risk factors for people running into problems? Well, as I say, the older you were at the time you had a transplant, there were signs that perhaps there were problems before the transfer. So your liver tests, bilirubin, etc., were a bit up and down. So actually we can perhaps predict those patients prior to transfer that they were already running into problems anyway. And the medicines they take were a bit up and down. So that suggests that they were perhaps forgetting to take medicines on certain days, going through periods of taking medicines, and also attendance at outpatients. So really the messages from that are, if you're older, if already your liver's running into problems and there's signs that you're not complying with your treatment, then you're more likely to run into problems. What about, we do run an integrated transition service, and of course it could be better, and we're always aiming for it to be better, but does it make a difference? Well, there's some evidence from kidney transplantation where really if you do miss any medicines, you very quickly can lose your kidney. That actually it does improve outcomes if you have a good transition service. And I can only talk about our service, but she's here in the audience, Monica, and without her we would not have our service. And we have our youth worker who's just as crucial, and we've just now got a psychologist which is going to be absolutely fantastic. We have dedicated clinics. both at the Children's Hospital and then at the adult hospital. But the key to the young people feeling like they always have someone they know are our transition team and not the doctors. And we're also going to be moving to a dedicated facility for these clinics, the Institute of Translational Medicine, next year. And what about you? What can you do to help your children for this process? I think when you feel comfortable, it's important that part of your appointments with the doctor, part of your child's appointments with the doctor, they have some one-on-one time. And a lot of young people really want that, sometimes so they can feel they can talk openly without their parents there. And that's going to be hard for you. You're used to always being there. It's not saying you can't be in the appointment, but gradually more and more they will want that appointment. And eventually they will only want to be there by themselves. And quite a lot of parents find that difficult. So the earlier you do that, the more confident you'll feel about that. Allow them to speak. Give them that time with their doctor. As early as possible, start to encourage them to manage their medicines so they can understand the importance of taking their medicines. Rather than they're not taking the medicines for you, they're taking for themselves. Encourage them to know about their condition and the management of the condition, because the more they know, the more they'll realise why it's important to go to the appointments, take their medicines. Whenever we've had young patients who've really struggled, the most effective thing is them spending time with their peers. And our team have organised a number of these days where they've got together with peers, and I've often seen very different youngsters after that who just feel so much more self-confident that there are other people with the same issues. And lastly, I'd say be positive about transition. I think if you are negative, it's only going to be a negative experience. So I guess in summary, I think it can be a difficult time for all people involved, but there are many positive aspects, and in fact it's just part of moving on as so many other aspects of that time in life. And certainly evidence suggests that if you put in a good service, that does improve the outcome. Thank you very much.